Chapter 5 will continue our discussion about needs assessment, but we'll be looking specifically at approaches to measurement. And so we'll explain various approaches to measuring need, how to use available data and information in assessing need, how data from local agencies can be used as a resource in determining need, the pros and cons of conducting an original survey, the pros and cons of holding public meetings to determine need, ways to be sure that the needs of groups to be served are incorporated into the assessment. So again, we'll look at those methodologies and other related factors to measuring need as related to a needs assessment. So some of the methodologies used in measuring need, sometimes we're extrapolating from existing studies, sometimes we're using resource inventories, sometimes we're using service statistics. We may be conducting a social survey, may hold a public forum, or hold different focus groups to understand and to measure need. So extrapolating from existing studies, this relates to normative need that we discussed in Chapter 4. Secondary sources can provide the most efficient and effective strategy for assessing need when time and resources are limited. Federal agencies charged with collecting, compiling, analyzing, and publishing data for general use, the National Center for Health Statistics, the Bureau for Labor Statistics, the Bureau of the Census, and the Department of Agriculture's reporting service. And I mentioned before, we also see like the CDC, we also see NIMH as being sources of data and studies related to mental health and healthcare. When we think about extrapolating from existing studies, there are some strengths and limitations of surveys. So 2 survey qualifiers. Data from national surveys will not be specific to a local geographic area in a lot of cases. Sometimes you can find this data in county or city resources that you may find. So differences in population characteristics must be weighted if we're using aggregate data like that. Definitions behind estimated rates vary, so select studies that incorporate definitions that are meaningful for program development in a particular community. Okay, complementary approach to surveys, consultation, expert opinion. There are some strengths like cost are likely to be reasonably low, time required is likely to be short, credibility of budgetary requests based on expert opinion is fairly high, but some of the limitations, again, we may see some potential bias at various levels. Complementary approach, again, looking at consultation or expert opinion. Consultation should be initiated only after a basis or basic program strategy is outlined. Consultants then relied on to offer suggestions based on their substantive expertise. Estimating numbers at risk, establishing feasible targets, and designing relevant programs or interventions. Using resource inventories, this could also speak to normative needs. So here we're mapping strategies that attempt to identify the total system and its boundaries, focuses on an identifiable at-risk population group, identifies all agencies that offer service to the at-risk population group, develops discrete and meaningful categories of services grouped by function and purpose, eligibility criteria used, and the perception of overall capacity to meet greater demand. Some strengths and limitations to resource inventories. Some of the limitations, terminology varies among agencies as to what certain activities encompass. Many communities have resolved this by designing a taxonomy of common terms covering problems, needs, and services. One of the strengths, or some of the strengths here of resource inventories, information facilitates evaluating whether existing system is functioning to capacity, specific agencies in the system are capable of serving more people, and services overlap. Looking from this lens at service providers, survey service providers to assess what they consider the problems to be based on day-to-day practice. Engage service providers through surveys indirectly invites them to become members of the planning team, which can generate their cooperation in the process. And recommendations from service providers are based on their knowledge of consumers and not on the non-user population. So that can be really helpful. Using service statistics, this speaks to that aspect of expressed need. It involves analysis of utilization data, which builds on the inventory of resources, becomes the basis for collecting service reports from direct service agencies, also utilization data. Utilization data categorize service by who, what, from who, and at what cost. Who data describe the characteristics of the utilizers? What data describe the services provided and the volume of those services? From whom data documents staffing ratios and case loads? At what cost data describe gross financial data used to demonstrate the level of commitment for a specific service and to extrapolate the level of resources necessary if services expand. So again, using service statistics, there are also strengths and limitations to this approach. Some of the strengths, the availability and accessibility of the data, economical to rely on existing data, enables analysis of trends in service delivery and demand, minimizes the problem of increasing expectations among recipients or potential recipients. Limitations, they do not provide adequate data about prevalence of unmet need. Characteristics of groups with unmet need may differ significantly from those receiving services, and waiting lists are affected by actual service provision. Conducting a social survey, this relates specifically to perceived need. So some of the strengths, most powerful method available for assessing need, provides original data tailored to the specific needs of the geographic area or the community that has been identified, can produce information on the attitudes of consumers and potential consumers. Social surveys identify the respondents' perception of need and determine knowledge of and barriers to existing services. The purpose of social surveys is to provide a valid description of a situation in conceptual and operational terms. The description facilitates construction of appropriate data collection instruments, sampling, conducting interviews, analyzing the data, and planning recommendations. Social surveys can identify shortages or barriers to utilization and serve to legitimate change, heighten the awareness of a community and serve an educational purpose, produce support for the recommendations, and establish baseline data and reference points for evaluation at a later time. Some of the limitations we see with conducting social surveys: time and expense involved in social surveys are often underestimated. Analysis strategy often put off until after the data are collected, but should begin in the design phase of a survey. Survey instruments need to be pre-tested. Sampling procedures must be appropriate so that data can be generalized to the total target population, and population expectations may be raised. Holding a public forum, this can also relate to perceived need. Usually an open meeting to which the general public is invited to offer testimony. It may be required by law in some cases. Needs and priorities are determined by a consensus of those involved in the process or through tabulation of articulated concerns and later prioritized. Some of the strengths we see with these public forums or public hearings: public meetings are compatibility with democratic decision making. They're compatible there. They're less costly than surveys in terms of time and money, and they encourage clarification of issues and cross-fertilization of ideas through open discussion. I like that term, cross-fertilization of ideas. Looking at some of the limitations of public forums or public hearings: representation. Do participants represent individual needs or the needs of the community? So again, some people who are there presenting ideas and discussing this may not be representative of every single person or opinion in the community, and so it's important to recognize the limitation there. Addressing the limitation of representation: anticipate possible problems before holding forums. So again, just kind of trying to work through and think about some of the issues that may arise and some of the biases that may be present, some errors that may be already kind of pre-existing there. Allocate resources to reach target groups to produce a cross-section of the community. Use process techniques to structure participation for needs assessment and problem analysis to optimize effective participation by all present. Using focus groups: ask participants for opinions, beliefs, and attitudes toward a product or service to refine the product or service. Uses a homogeneous group of participants. So meaning they're similar. So selecting the best method, we talked about some different ways of getting this information and assessing need. Methods are not mutually exclusive and each contributes distinct information. Not need to determine which methods are feasible given resources and constraints. And again, it can be, when it says it's not mutually exclusive, we're just meaning we can use a combined approach, use multiple different approaches here, depending again on our constraints with resources and time. Approach is useful for locating concentrations of high-risk groups. So this is an overview of the issues. Program planners are expected to formulate plans, develop policies for plan implementation, formulate criteria for priority setting and resource allocation, and establish a monitoring system. A needs assessment is related to each of these activities and has a major input to priority setting and resource allocation considerations. A need for spatial analysis. Social problems in need are not uniformly distributed in geographic space, and variations must be assessed when we're looking at communities and the extent of the areas being served. Spatial analysis define use of social indicators to classify geographical areas into typologies. Construction of social indicators involves combining more than one variable to form an indicator. Underlying assumption of indicator construction is that no one variable by itself is capable of tapping into complex social phenomena. I don't know if you've heard about GIS, but it's a software that looks at geographically mapping some things related to community characteristics. So may be worth looking into. Factor analysis. This is a statistical technique used to make a large number of variables take a large number of variables and reduce them to a smaller number of constructs or indicators. The premise is if a large number of variables are intercorrelated, interrelationships may be due to the presence of one or more underlying factors. This has been used for human service planning since the 1960s, although our ability to do this has changed quite a bit over the years just because now we have different software packages that are helpful in running factor analysis. Okay, concluding comments on needs assessment. Needs assessment has both qualitative and quantitative dimensions. Needs assessment methodologies are interdependent and no one provides a total assessment. Techniques can produce estimates of need that can be used both to educate the general public and to gain support from decision makers. Needs assessment targets can be translated into resources and budget estimates. Formulation of goals and objectives is directly influenced by the needs assessment, and estimates of need become the basis for the evaluation of program adequacy. So again, they are a very vital part to this whole piece of program planning.